Hello and welcome to the Community Data Portal webinar. We're going to go ahead and get started now. My name is Michael Topmiller. I am the GIS Data Specialist at HealthLandscape. Today we're going to talk about the Community Data Portal webinar, or Community Data Portals, which is one of our latest tools that we've developed. Just a little background information on HealthLandscape. So HealthLandscape is a social enterprise that develops geospatial tools. We have a free website, www.healthlandscape.org, which provides users the ability to make maps, find data, and do a number of other things that could be useful for your organizations. But what we talk about today actually builds off the HealthLandscape platform, and they're called Community Data Portals. If you're interested in more about HealthLandscape, that site, we also offer webinars and resources for that as well. Just a little outline of what we're going to talk about today. I'm going to begin with a brief description of what Community Data Portals are and why we created them. Then I'm going to go through our site, CommunityLandscape.org, which houses a number of our data portals, and then go through some examples that we've built and show you how you could use data portals using all the different tools that HealthLandscape offers. So we'll start with the problem. And actually, before I do this, I wanted to mention we have a pretty large group today. So if you do have questions, you can go ahead and write them in your question box there. And depending on whether or not it seems urgent, I may get to it, but I would prefer to wait to the end to answer questions, and I can actually stick around for 10 or 15 minutes or so and answer questions and chat with those of you that are interested in talking about some more specific things. So let's get started here. So the problem, why were the data portals created to begin with? So in Cincinnati, which where we're located, we have been taking part in community needs assessments and community health assessments and state of the region reports and a number of different projects and reports that focus on different things in the region. The problem is that we actually were helping create these reports, and we have a number of them sitting on our desks or on our shelves in our office. And while these reports contain a lot of useful information, they were basically not being used in a way they could be. So what happens when you have multiple organizations basically doing the same kind of reports with the same data for roughly the same audience, you kind of have this inconsistency as far as the type of measures that are being looked at, a lot of time and effort being put forth to do these reports. If any of you have been involved with them, it is quite costly, both in financial resources and time. And really, after the reports put out, they're not utilized in a way that they could be because they're static reports. And this happens, in Cincinnati, and it basically is happening in most of the regions across the country. So the solution that HealthLandscape came up with was basically building a community indicators data portal, something that sits on top of the HealthLandscape platform. I'll talk more about that in a few minutes. So for Cincinnati, we created a Cincinnati data portal called Facts Matter. And I'm going to go through Facts Matter in more detail as we walk through some of the examples. But some of the benefits of doing the data portals is that it lowers development costs compared to developing a new system. So if you want to develop an online system or dashboard type thing with mapping capabilities and other visualization tools, it's quite expensive to develop a new system. HealthLandscape gives you the ability to leverage what we've already built and just put it on top of that, in addition to all the data and tools that we have. Not only that, but as we develop future enhancements and new tools, those are automatically made part of the data portals. Other benefits include that it can eliminate static reports, and I'll show you an example of how this was actually done in the neighborhood or metro region in Canada. You don't have to wait for the next kind of report to come out. You can actually update these in a more timely manner, you can have users actually interact with the data. Other advantages is you can actually team up with organizations in your region and kind of selectively share that data. You can reach a wide audience of decision makers and community members if you choose to make this data portal public. So now I'm going to go ahead and jump into some examples. Well, first I'll show you CommunityLandscape. This is just communitylandscape.org, and this is where there's more information about our data portals. And also, if you look at the links on the bottom right hand here, we have basically links to a number of demo sites that we've created, in addition to all the live sites that we've created for different people throughout the country. And of course, it wouldn't work there, as that always seems to happen in webinars. Things don't work as they should. So without further ado, I'm going to go ahead and go into some of the examples. So the site that you're looking at now is Facts Matter, which is the Cincinnati data portal. So it sits on the website of the Community Research Collaborative at the University of Cincinnati. And they are just one of a number of partners that helped develop the site and that contributed data and resources. So go ahead and click here to enter the portal. And within a few minutes, it should pop up here. Now, this site was actually created the partnership of a number of different organizations. If you look at the bottom of the screen here, you can kind of see it's pretty small. But work with the United Way of Greater Cincinnati, the Health Foundation of Greater Cincinnati, a number of other local partners contributed to the site with data and other ideas as far as what are the types of things they wanted to see on the site. So we have a number of different categories here with different kind of indicators. And one of the big things about data portals in general, and in Cincinnati you can see, you have a mix of kind of public data sources that are available at the national level, along with kind of regional data, whether it's like school district type data and things like that. And you also have very local data, and actually you can see all three with the data portal here. So if we go to population, we can actually see just some basic census indicators looking at the county level in this case of population in the region. You can actually choose the level of geography you want to see here. So we have county level data here. We could zoom in a little bit. So we have this, but we also have, go to children and youth here. We could actually skip it here. We have county level data of education. We can also scroll down here a little bit and look at some local level education indicators. And here we have, for the state of Kentucky, not just Northern Kentucky, but school district indicators that we can map and visualize in different ways. In addition to having the public kind of and the regional data sources, we also have local data sources. So in the Cincinnati area, the Health Foundation helps to put together a local health status survey. So all of that data at the county grouping level we have here is made up inside this portal that users can map while also looking at the data and exporting it if they so choose to do so. So there's a number of different things you can do with the data portals relating to the types of data that can be put in. The next example I'm going to show you is from a site we're creating for the United Way of Kentucky. And I want to illustrate in this example here just the different ways you can visualize your data. So we saw in the Facts Matter portal the number of different data sources and the ways you could bring in data from various levels of geography. Here I'm going to show you there's different ways you can visualize data, beginning with kind of a dashboard type system here. So you can look at, for example, in this case, what the state of Kentucky is compared to either national benchmarks or Healthy People 2020 benchmarks and things like that with this kind of dashboard type thing here. So we're interested in college readiness, high school graduation rate, we can go ahead and hit Show Me, and we'll actually link you directly to the Kentucky data portal here, to that indicator. Let's take a few minutes. And here we have some county level data for education. And notice when here we have the map here, when we scroll over the map, we actually have in the upper left-hand corner here some information about what we're mapping. So it's and also the county that we're mapping. So in addition to the map here, we also have different tabs, data, chart, and resources. So if I go ahead and let's look at health and access to care, we'll look at percent uninsured. So this is just a national data from the Census Bureau looking at health, the percent of people that are uninsured. So here we have our map where dark colors indicate higher rates. But we're mapping 2010, but we also have data, as we scroll over each of the counties from the previous 5 years in their percents. Which is when you scroll over each of the counties, it pops up in the upper left-hand corner. But we also have the data, if we want to look at the data, which we can filter in different ways here, eliminating columns, adding columns if we like, things like that. We have information about the data, the metadata. We can export this data if we just wanted to take it and do something else with it. We also have charts, so we can actually see each of the counties in a bar chart here. And we can sort this, say we want to sort by chart values. Here we have a target and a Kentucky benchmark, so you can actually add different kind of benchmarks that you want to compare each of your geographies against something here. Since this is trend data, we can actually graph this. We can actually choose and add and subtract our different counties here, compare that against here our target or against other counties. So there's different things you can do, different ways you can visualize the data in HealthLandscape with the community data portals. Now if we go back to our map here, if we notice in the bottom left-hand corner here, we have our legend, where I mentioned before, where you have darker colors indicate higher rates of people that are uninsured. But we can actually change the color scheme if we like. Now that doesn't make it, this is a quantitative kind of set here that would make sense with this kind of color scheme. But there's different things you could do depending on the kind of data that you have. You can add and subtract the number of categories depending on what you're looking at. We can add 6 categories. We could change colors. Say you want to match well with the color of your organization to put in your report or something like that. And you can also change distribution. So right now we're looking at a quantile. We could change equal intervals. There's different options that you have where you can dynamically change the way you're looking at the data. Okay, so moving along here, I'm going to move off of the Kentucky website for the time being. So we've seen a data portal at the metro level with the Cincinnati Facts Matter portal. Here we've seen a statewide portal. Now we're going to look at another statewide portal called the NC HIP portal. Now this site was created for a network of health centers in North Carolina that deals with roughly 90% of the Medicaid population there. So here if we actually link directly to their website here, here we have the North Carolina Community Health Information Portal. Now again, talking about the data, here we have a number of different data sources. So we have community characteristics, which is all census data, community health assessment data, which is a number of categories here that were chosen in collaboration with HealthLandscape and people that develop or that are working with this site. Also notice this is actually a public site that anyone can access, but they also have sites that only people that are involved in their organization that are directly involved with their clinical data can access. So you can actually, there's network sites for 14 networks in the state that are part of the Community Care of North Carolina, and they can actually access their data at the clinic level. Now here we can look at their Medicaid cost and utilization data here at the county level. We have different quality improvement variables here, so asthma, cancer, a number of other things. This is all of their data at the county level, but they also have access, certain users with password-protected accounts for their clinic level data for their different networks. So you've seen these thematic maps and how you change colors and things like that, but you can also do a threshold map. So let's go down to the bottom of the screen here, and we have our colors. Looking at a thematic map, we'll change the threshold. And let's change the variable. Say we're only interested, let's look at diabetes, and we just want to look at those counties, people that have A1C scores that are above 9. So you want to kind of target these counties for different kind of interventions. So here we can see the map. There's the darker colors are the higher ones, but if we do a threshold, we can actually say we want to target all those counties. We'll change the color here to red that have a rate of 40% or higher with this high A1C score. And here we can actually target, see what these counties are. We can see some of the other data that's available with this indicator. This is kind of a quick way to focus on areas with really high scores or really bad scores, depending on the type of indicator that you're looking at. Now, another really cool function about the data portal is that you can actually look at 2 indicators at once to kind of help look at relationships. So let's go ahead and change the indicator here. And so in North Carolina, as in many states, there's some kind of anecdotal evidence that with the increasing Latino population, that is driving up the cost of ERs. So Latinos are coming to the U.S. They are not accessing traditional medical or healthcare resources. They're going to the ER. So you're just curious about this relationship. Let's go ahead and we'll look at the, I'm not sure what that was, or it's not going to let me do it here. Okay, so look at percent Hispanic here. We'll go ahead and add a secondary indicator. We'll go ahead and look at health system performance, and we'll look at healthcare costs. So we're going to go ahead and compare. On the map on the left here, we have percent Hispanic by county. On the map on the right, we have average monthly emergency department cost. So it looks like there may be some relationship, but it's not very clear. When we pan over, we see how the 2 maps connect, but it's really hard to draw any real conclusions from these maps. So we actually have another tool called the comparison tool. So it's down here at the bottom of the screen. We can actually put the 2 maps together looking at percentiles. So let's go ahead and set this to 75. So what we see here actually are dark blues are counties that have high percents of Hispanics as well as high emergency department costs. So it actually takes the 2 maps, puts them together based on percentiles. So just in the where we have low percent Hispanics and low ED cost are the yellows here, and the other choices are the other colors here. So it's these blues are the one we really want to focus on if we're interested in some kind of intervention to reduce ED costs and find other ways to get Latinos out of the ER into other healthcare resources. This is one example of how this tool could be used. So I'm going to go ahead and move away from North Carolina and focus on our next case here. So this site we're looking at now is called the Halton Our Kids Network. And so we created a data portal for them where basically we took a static report that was done either every year, every couple of years, which we can actually see here. They have a report card they do looking at a number of different indicators for their youth and adolescent population. So you can actually see the different categories and different things they're looking at as part of this report. We turned this report into a, let me get to the categories here. So Here's the first one, children are healthy. So the number of indicators they look at. We turn this report into a data portal. So all the categories that were inside that static report now are made up on this dynamic site at the neighborhood level. So we saw some state sites with North Carolina and Kentucky. We saw the regional site with Cincinnati. But here we have an actual neighborhood level site. They're taking local survey data and mapping that at the neighborhood level. This is Halton, Canada, which is just southwest of Toronto. So this is just another example, another way that you could actually have a data portal here. Another thing I want to show you is there's a number of different kind of geographies that you can actually add and subtract if you want to see different things. So you can actually add census tracts, these are Canadian census tracts, and other kinds of custom geography for the region here. So we did this for Cincinnati and all the other sites that we have. Okay, so now I've gone through pretty quickly several examples of data portals. Now I'm going to go back to the Facts Matter portal in Cincinnati and show you some other things that you can do with the portal. So we've seen basically different ways you can visualize the data. We've seen how you can combine different data sources and use public and local and other kinds of data to make up your portals. What we can also do actually is add some tools that are available on the HealthLandscape platform. So these are, if you want, I'm going to go through this pretty quickly here, but if you want more detail, I discussed these in more detail in our HealthLandscape webinars. These are free tools that are available at HealthLandscape as well. But you can actually have these tools as part of your portal, as I'll show you here with Facts Matter. So I'm going to go ahead and set up just a scenario, kind of a potential scenario that could be happening in any region in the country, but for the northern Kentucky part of Cincinnati. I'm going to go ahead and show you how you can bring in your own data and kind of have that data interact with the data that's already part of the portal here. So let's go ahead and start with our tools and our quick geocodes tool here. So there's some basic instructions on what this is. Just pretty quickly, quick geocodes is taking address level or point level data and putting that on a map. So here we'll go ahead and click here to begin. Go to our data here. We'll go ahead and Control C and copy. Bring it here, Control V to paste. The key things to remember about the quick geocodes and the next tool I'll show you is basically matching kind of the things you see on the right-hand side here with your data. So we want to match the address, the city, state, zip. Here we have most of that information. That should be enough. Title, this is actually school data, so we'll title by school. And group category is what we want to map by. So we'll go ahead and click on this value added variable here. What we're going to do is I want to investigate in the Cincinnati, Northern Kentucky region, looking at school performance and compare that against some other types of data. So let's go ahead and we'll geocode this. And so we see pretty quickly the number of schools that we have in this data file show up on the map here. And they're colored by the variable that we map, so school performance, where the red dots indicate poor performing schools, below average. The blue dots are basically average scoring, and the green dots are above average. It's actually, if you're from the area, this is made-up data. I just took the schools, put some data in, and made this up. So don't try to use this for anything else, just simply to illustrate an example here. Now, if we scroll over a dot, it actually, the name of the school will show up, and the score will show up here. But we also have some other data associated with. So if you go to the right-hand side of the screen here, we can add and subtract things you can see. So let's go ahead and say we want to add all the school information. So I add the address, the city, the zip. We'll go ahead and add percent low income and percent with disabilities. Now when we scroll over one of the dots here, go back to the example, we see the name of the school and all the other information that we have for that school. So here we have a map location of our schools in Northern Kentucky. Say we want to say, okay, we think that poor performing schools are most related to poverty. That may help explain why these schools are underperforming. So let's just go ahead and we'll go back to our Facts Matter portal here, our data. We'll go ahead and go to economy and poverty, and we'll look at poverty by age at the census tract level. It's going to take a few minutes to load here. I see a few questions coming in, and I will get to those shortly after I finish with the demo, if that's okay. If you have to leave and I don't get to your question, feel free to email me, and I will make sure I answer your question. Okay, so the data came up here, and here we have poverty data for percent under 18 at the census tract level. Now we can actually see that data with our schools on top of that data. So we can actually see where are the high poverty areas, the darker blues, and where our schools are. So you see there is some relationship on this map. We can go ahead and let's add the number of categories, see if we can really pinpoint this. And you see there looks like there's some relationship. Might be a little bit difficult to tell. Let's go ahead and say we want to focus on just the highest poverty areas. We can actually use our threshold tool here. Say let's focus on those areas that are 50% or higher. So here, looks like in the Covington, the more urban part of Northern Kentucky, there may be a pretty some relationship between the low-performing schools and poverty. So this is just one example of how you can begin to look at this relationship. So say this is something we find very interesting, and so if you want to print this, we can go ahead to the print function. We have this dynamic ability to print, so you can actually zoom in and out as needed. You can title it. You have some different legend information here. If we want, we could save as a PDF. Another thing we can do is we could share this. So we can click on Share, and we can actually copy this into an email or something else, and whoever receives that can actually take this link, and it will take them directly to this map. Something I forgot to do is I'm going to go ahead and log in here. And I'm logging in because while it's a public site that you can access without logging in or doing any of that stuff, if you log in, you can actually, we go to quick geocodes here, we can actually save this. We'll save this as NKY school data. Hit OK. So if we are working on this, we have to do something else, we can actually come back in, log in, and it will be here, and we can actually bring this right back up to the map. And I'll show you how we can do this in a few minutes. So that's interesting. We think there's a relationship between poverty and school performance, but now we're also interested in, we think that food deserts or food insecurity has something to do with school performance. So we think that students that don't have access to healthy foods are more likely to score worse in school. So let's go ahead and we'll turn off our poverty variable there. We'll go ahead and close out a quick geocode. I'm going to show you the next tool that we have here, and that is quick themes. So this works in a very similar way as the quick geocodes, except that we're not looking at point level data. We're looking at some kind of geography. So either the county level, the census tract, zip code. This actually happens to be census tract level data called the Modified Modified Retail Food Environment Index from the CDC. And what this is basically looking at the percentage of healthy foods by census tract. So we'll go ahead and paste that in, Control V. Now the important thing to remember with quick themes is the type. Now I know this is census tract 2010 information, but that whatever type of geography it is, you have to make sure that your ID matches that geography. So the census tract level, we have an 11-digit FIPS code that I know we need. If you were mapping county level data, you would need a 5-digit tips. So that's an important piece of this. We'll go ahead and title it by name. We'll go ahead and group category is the variable to map. We're going to map the Healthy Food Index. I'm going to go ahead and load this. It's going to take a few minutes here. So what the Healthy Food Index is, you're actually creating an inverse score for this. So higher scores are census tracts that have less healthy food. So we want to have lower scores. So the relationship we want to see here is, do our low-performing schools reside in census tracts that lack healthy food options? So we'll see what this looks like here in a minute, hopefully in a minute. Okay, there we go. And I'm just looking at Kenton County, Northern Kentucky here, so I'm going to go ahead and zoom in a little bit here. So we see that our darker colors are our areas that are, or sorry, I was wrong. So higher scores are, higher scores are better, lower scores are worse. So I apologize for that. So you can see that the higher scores actually seem to be concentrated into these areas here. So I don't know what that will tell us. Let's go ahead and go back to our quick geocodes here. And we'll go ahead and bring back up our school data, restore. And here we have it. So now we have our food desert, food insecurity data on top of our school performance data. And it seems to me there doesn't seem much of a relationship, because the dark colors actually are areas with access to healthy foods, and our lighter colors are not. We can go ahead and go back to our threshold tool and see if there's any relationship here. Doesn't really seem to be much of a relationship, but you get the idea that if you did have data that made more sense, that was able to tell a better picture, you may be able to either answer some questions or at least lead to more questions based on whatever your topic you're interested in. So you definitely have different options here. And again, you could actually export this data if you'd like. If you say you want to focus on this area here, and this area, you can use your drawing tools here. We'll go ahead and we'll draw a box around this area here. We'll change this color. We can go ahead and label this here, target area. And then we can go ahead and print this if we like. Looks like I cancel. I gotta close out the toolbar here. We can print this if we like. Save as a PDF, we give it a title, or we could just share this. And so I did this a lot of times. I'm working on these maps. I just basically copy it and paste it to my own email so I can come back to the same place I was working. So there's a few different options you have. You could also, again, you can also save this. If you want to interest in this quick themes or in this data set, we could save this as well. So there's several different options that you have working with this. Now I think that is about all that I had planned for today's webinar. I know I went through several things very quickly. So what I'll do now is I'll go ahead and answer some of the questions that came up during the webinar, and I'll stick around for 10 minutes or so and answer any other questions that you may have. Also, my email is on the screen and my name here. If you have questions in the future down the road, working on the system, feel free to send me a note if I can help you with any kind of issue. So let's go ahead and start with the questions here. So can you get to this United Way, the website? I think we'll find it. So actually this website is still basically under construction. It's a demo site. So we're still working on it, so it's not quite ready yet. I can provide you with information in the future. I can send you an email when I know more about when it will be ready or when it will be available to the public. I actually am posting or recording this presentation, and I can, right now the presentation is not posted anywhere, but I can send it along if you're interested in an email. It's no problem. Next question is, what data goes down to the census level? Does health statistics break down at that level? Now that's really going to depend on the data set and which data set you're referring to. It's very rare that you'll find health statistics at a level below the county. It's more difficult to find local level health data. But if you can send me a message, or you can ask me now of what data you're interested in and what level, and I can let you know if we do have that data available or if we can find it. I can show you that. I forgot to bring this up before. It's actually another tool that is available on our community data portals, or as part of our community data portals, that I forgot to bring up. It's not currently active on any of the portals, I do not believe. I'm actually going to show you on HealthLandscape.org our community health view. And what that is a large library of data. It's not coming up here for some reason. I typed it in wrong. Let's see, try it again. Doesn't seem to want to come up. But anyway, if I ever do get it to come up here, healthlandscape.org is a free website that has Community Health View, which is a tool that you can basically search for data in our large library of data. So we're talking about a number of public sources. Here we go. Go ahead and log in. So a lot of CDC data, a lot of census data, other types of government data that's available. Most of the data that we have is at the county level, although we are starting to add some lower level geographies, census tract and zip codes. So say we're interested in obesity, we'll pull up the CDC National Diabetes Surveillance. I'm actually working on, one of my responsibilities is actually updating this system, so I'm actually working on putting in the 2010 data for this. So let's go ahead and look at percent obesity. And here we have a county level map of obesity for the United States. You can actually add different indicators to our tooltip here. So when we scroll over a county, say Boone County, we have the variable that we're mapping, but also the other data that's associated with that. Now this data, you can look at it in a data tab format here. You can actually export this data if you want to do something else with it. So it's a pretty large library of data. You can actually search for a number of different things. Is there any other questions or things that I can show you before we go? So like I mentioned before, CommunityLandscape.org has most of our sites. You can link through this site here. And if you can't find one I showed you today, you can go ahead and send me an email, and I'll be happy to share with you some of the links. Okay, so if there's no further questions, I'm going to go ahead and end the webinar. Like I said before, feel free to contact me if you have any other questions, or if you'd like a recording of this presentation or the slides, I can send those to you. So thanks for your attention. I hope you guys have a great day. You're welcome.